15,000 employees as part of a larger plan to cut the agency's workforce by nearly a quarter. The Food and Drug Administration will lose 3,500 staffers. The National Institutes of Health will lose 1,200. The Centers for Disease Control and Prevention will lose 2,400 employees, and the Centers for Medicare and Medicaid Services will lose about 300 workers. Health and Human Services Secretary Robert F. Kennedy Jr. announced the cuts Thursday in a video message.
I want to promise you now that we're going to do more with less. No American is going to be left behind. Our key services delivered through Medicare and Medicaid, the FDA and CDC, and other agencies will enter a new era of responsiveness and a new era of effectiveness.
CBS News Chief Medical Correspondent Dr. Jon LaPook joins us now. So, Doctor, what will these cuts mean for these agencies? Can they do less with more? More with less?
More with less, or the same with less even would be good. But I mean, I think the point here is the devil's in the details. RFK Jr. today talked about radical transparency. And I'd love to see actually the analysis where they say, okay, we're making these cuts, and here's why. Here's the repercussions of them. But in the absence of seeing, all those details, it's really hard to know exactly what the effects will be.
He does acknowledge, the secretary, that this will be a painful period for HHS. I mean, what are your contacts saying? How's morale? What are they feeling?
Morale is low, especially in researchers who have this uncertainty about what's going to happen. So there's still a lot of we think this is going to be cut, but we haven't heard for sure. People are refreshing. I had one researcher who was doing a certain type of research, and he said, I keep hitting refresh all weekend long last weekend to see whether my grant was cut, which it wasn't. But this, this uncertainty is not, none of us like uncertainty. Right. So people are on edge. And I just think, when you talk about cutting from the NIH, and there are the repercussions that it has right now, and from the other agencies, the repercussions that it has right now, and that's one thing. But then how about down the road? Right. You're talking about a generation of people who are in high school and college now. They're trying to decide, do they even go into science? And they're seeing all these cuts happening. That's discouraging. RFK Jr. also said this morning, we want to increase the number of scientists. So you're cutting funding to the NIH, but you want to increase the number of scientists. So how does that square? It may be, because they said in one of their press releases, for the FDA, for example, we're cutting 3,500 jobs. We're not affecting drug approval. We're not affecting the food, looking over the food supply. So exactly where is it coming from? Well, it's administrative redundancy and HR redundancy. But I would love to see, at some point, there must have been some analysis made and a big, thick report. I'll do the deep dive on it. And I'd like to see exactly how they came to the conclusion. I'd love to see redundancy and waste, get rid of that just like the next person. But I'd love to see, do we know how that's going to affect people and will it do any harm? There was one figure, I drilled down on the website. It said a grant to the Texas Department of State Health Services, $877 million and more, $628,206 is going to be cut. That's the savings. So Texas, they're having an outbreak of measles right now. Where exactly is that coming from, and over what period of time, and what are the repercussions of that? Are we going to see cuts to things that are so important, like support of children and childhood vaccinations? We know there have been questions about vaccination support. So there's a lot of questions right now. Human beings don't like uncertainty. I'm one of them.
Yeah. All right. Well, Dr. Jon LaPook, thank you so much for your time and expertise.